Hello, good evening. And that's what we'll be discussing today. Not only the facial skeleton, but we'll be talking about all the cranial nerves, all the foramens, so through which foramen, which cranial nerve is passing, so that you got the complete picture, right? So today, actually, we'll be completing the entire skeletal part. So we have talked about the cranial part, and today this would be the second half, right? Before starting, it is necessary, right, the disclaimer, because in fact today's all images they are displayed, which will be displayed, they are not suitable for audience of all ages, right? They are for medical training purpose only, education purpose only. All right, that was official. Yes, good evening. I'm good. All right, so here we start. So these are the bones which we already know, right? So that is frontal, right? This one would be parietal, and that's temporal. Then zygomatic arch. This was that's sphenoid. Mandible is obvious, right? This is mandible. And then there was cheekbone, right? This was the cheekbone. So it was zygomatic, right? That was the cheekbone. And this is maxilla, upper jaw. We have talked about these many bones. We'll be adding something extra to this. One, this is the ethmoid. Now, these are very small bones, and we'll be talking about them in more detail as we'll proceed. Then there would be lacrimal, and this is nasal. So these three bones, they'll be appearing today, right? Rest of the bones, they are already known to you. Now let's talk about, say we have removed the mandible part, right? We have removed the mandible. So see, this is the orbital cavity, right? So that's the orbital cavity. We have removed the mandible, and this cavity, obviously this is the cavity for the eye, right? For the eyeball. Now in the eyeball, so if this is eyeball, very crudely, if we really draw, right, then we can draw something like this. What are these? These are the muscles which are going for all the movements, right? So today, parallelly, though all these topics will be coming in great detail when we'll be talking about the eyeball, right? But still, to get a complete picture, rectus means straight. So this is the eyeball, right? This is superior rectus, inferior rectus, medial rectus, lateral rectus, four straight muscles, superior oblique, inferior oblique, right? I'll keep on telling you some of these extra piece of information parallelly, so that preparing you for the our tomorrow's session or our next session, where we'll be actually be going for all the soft tissues, right? That is the dissection part. So just keep it in mind. And with that, right, so that is the orbital cavity. This orbital cavity, as such, if you see, it is made up of so many bones. So we'll be talking about it. And this one is nasal cavity, right? Now see, all of them, they are big, huge topics, right? Nasal cavity. In between, you can see that that is a nasal septum. right? Nasal septum, nasal septum, right? This is the point, right? That's the point. This is where two maxilla meet. Fair enough, right? So they join over there. Now let's see from the side. Some things which are already known to you. So it is this junction, right? And this entire piece. This is the zygomatic bone. This is the zygomatic bone. And this one is the temporal bone. And they both are forming that zygomatic arch, right? Zygomatic arch. All these things, they are pretty clean. Okay. Now what we do is, this much was known to us. Now we are adding something to it. Think about that this area, I mean, this area, right? How it is happening? Here is the zygomatic bone, correct? This is one arch. That means there is a hollow space over here. There is some hollow space over here, right? That is a hollow space. Because see, arch is like this, that bone, the zygomatic bone, it is in front, and this temporal bone, right, that is on the sides. So actually it is forming one hollow space, and that space is called as the temporal fossa, right? So this is a new thing which we talked about. Now, this temporal fossa would be containing what? Well, there will be so many things, but one important point, it is that it would be consisting of a big muscle, and that is temporalis muscle, right? So temporalis, that's the muscle, and it is this area that is the temporal fossa, right? So this is first thing which we learned. Now see, all these bones, right? All these bones, they are actually, so because this question was asked, all these bones, they are made light by creating air spaces in between. And these air spaces, they are called as the sinus. Sinus. To be very specific, they are called as the paranasal sinus, right? Paranasal sinus. Again, paranasal sinus is a huge topic. But yes, parallelly, as it will arrive, we'll keep on talking about it. So when actually we'll be discussing paranasal sinus, it will be much easier, right? Now, watch for this. Can you appreciate, I'll zoom it. Can you appreciate like some bony line which is going up, right? Bony line which is going up. That is what is called as the temporal line. See, right? This line, right? That line. That line is called as the temporal line. Temporal line. So this one is temporal line. Then what would this be? That is the lateral orbital margin, because when you see, so yes, anteriorly if you see, this is the orbit, right? So this would be like a lateral orbital margin, right? Lateral orbital margin. So it's like if we see a skull, here it is, right? Here it is seen much better. This one, this is what I'm talking about. Lateral orbital margin, right? And over here, there would be temporal line, correct? And what it is over here, that is the zygomatic arch, right? So coming back over here, see, this is like zygomatic arch. Zygomatic arch. So what have we really tried to create? We have tried to create that space, right? This space, right? This one, this is the temporal fossa, right? That space is temporal fossa. Now, if that space is temporal fossa, right, it means the space which is above the zygomatic arch. So that is temporal fossa. But well, in that case, there is some space which is below also, right? There is some space which is below also. Here also there is a space. So we'll call this as infratemporal fossa. Infratemporal fossa. Now, in case if there is any confusion, just don't worry, right? Don't worry. These images, they will be coming again and again, and things would be crystal clear by the end of today's session. Think it this way, that when this is a zygomatic arch, then which bone will be just behind it? Well, that would be sphenoid, right? So this is sphenoid, correct? Sphenoid. And this is this bone on which all those teeth, they are attached. Well, that would be maxilla, right? So can we really say it like that maxilla is in front, but its posterior part is forming one of the wall of infratemporal fossa because there is no other bone, right? There is no other bone. Let's see. See over here, right? That's the maxilla. That's the maxilla. So, and this one is zygomatic. So if we really remove this arch, if we really remove this arch, right, we'll be able to see that what is behind. So we can do that. But meantime, if this is temporal fossa and this is infratemporal fossa, so that means in infratemporal fossa there is something interesting. And that is what? That is in infratemporal fossa, this is what is called as the coronoid process. This is called as the coronoid process of mandible. So we know now at least this, that in temporal fossa, it was temporalis muscle, correct? Temporalis muscle. And in this infratemporal, there is coronoid process of mandible. Plus, in infratemporal fossa, though we have talked about it, but still think it this way. You remember sphenoid bone? Sphenoid bone was having body. Then there was a greater wing, correct? Then there was a lesser wing, right? We are drawing very crudely, lesser wing. And then there were pterygoid plates, correct? Two pterygoid plates. So those pterygoid plates, they were going down. Greater wings and lesser wing, they were, right, on both the sides. So where exactly, just behind it, we'll be watching all these. Just over here, if we remove this zygomatic process, we'll be going over there. So there is that in this infratemporal fossa, we'll also be getting plus pterygoid muscle. Now, no need to cram, right? We remember pterygoid muscle because just we'll remove this and we'll see the pterygoid plates, right? So that's why we are telling that these names, they are very specific. So that's why pterygoid plates, they must be having something to do with pterygoid muscle. So that's how we remember. But as such, when we'll be talking about, say, pterygoid plates itself, we'll be discussing it in more detail. But these are the gross structures which are present over there, right? So this is the temporal fossa and infratemporal, two things. Here it is. The first look, and immediately you say that this is the base of the skull, right? So this is base. That's foramen magnum. And foramen magnum, this is basi occiput, right? Occipital bone part which is in front of the foramen magnum, that is basi occiput or basilar part of occipital bone. And then regarding the temporal, there was one petrous part, right? Rough part, which was actually forming the margin, right? Inside the skull. So it is over here, right? On the base. This is the petrous part of temporal, right? This is just to recollect and reorient ourselves properly that what exactly are we talking about. So that is basi occiput. Right? So that is basi occiput. Okay. Now adding to this. When this basi occiput, now we are talking about anterior part. Can you appreciate two ridges? One over here and one over here. Similarly, right, it is on both the sides. It's on both the sides. So what are they? Well, if we orient ourselves, what is this? This is zygomatic process, right? This is arch, zygomatic arch. From the teeth, we can say this is anterior. So we are dealing with something anterior. We just talked about that these pterygoid plates, they are located like this, right? There are two pterygoid plates. One is the lateral and second one is the medial pterygoid plates. Right? And these pterygoid plates, they are part of what? They are part of sphenoid bone. Correct? Sphenoid bone, which has got greater wing and lesser wing, and they can be seen very clearly when we are looking inside the skull. Right? We'll watch that. And what about these medial and lateral pterygoid plates? They are hanging down. So that's why we are watching it in the base of the skull. This is the base of the skull. And it is in which part? It is anteriorly, right? So that's what we are watching. These are all teeth, palate, hard palate. So just behind it is located over there. Okay. Now see, that's pterygoid plate, right? So that is bigger one, which is pterygoid, lateral pterygoid plate. Right? Here we are not writing again, so just for cleanliness. So that's lateral pterygoid plate. And this prominence, this one, right? So that would be the medial pterygoid plate. Now try to create the entire picture. When we say that, okay, this is right, very, very obvious, right? We say that, yes, this is nothing. It could be just opening of the nasal cavity. Looks wise, right? Looks wise, immediately we can know about it that this is posterior part of nasal cavity. Correct? Again, nasal cavity would be a fantastic full topic, right? But yes, anteriorly we saw, right? Anteriorly we saw that was nasal cavity, that was the anterior part, and this one is the posterior part. So this is posterior part of nasal cavity. They are called as the posterior nares, right? Posterior nares. The way we have got anterior nair, these are the posterior nair. A name is given, they are also called as the choana. Choana. So if it is asked that what exactly is the location of this posterior part of nasal cavity or the posterior nares or choana? Well, it is very easy. It is between two medial pterygoid plates. Right? Fine. This is one pterygoid plate. This is medial pterygoid plate. This is another medial pterygoid plate. So these posterior part of nasal cavity, that is the posterior nares, choana, they are in between two pterygoid, that is two medial pterygoid plates. Right? This orientation is vital, is very important. This is what this is hard palate, right? Hard palate. At any point, if you get confused, because today's session is vital, I don't know how much time would it take, right? Whatever the time it takes. But by the end of the session, there should not be even single confusion, right? So at any point of time, if you feel that, yes, there is some confusion, let me know immediately. Okay. So here it is, the hard palate, right? Hard palate. Now this hard palate, it is between roof of the mouth, right? That's the mouth. It is on the roof of the mouth, and above this hard palate, that is the nasal cavity, right? So there is a nasal cavity, there is hard palate, and then there is mouth. So it is nasal cavity is over here. This is hard palate, right? And this one is mouth. So it makes sense when we say that hard palate is forming the roof of the mouth and the floor of the nasal cavity. Good? Okay. Now in adding one more word, you can watch this, right? These are specific bones, right? That one, yeah. This is called as the conchae, or the turbinate bones, right? Turbinate bones. See, our brain is like, if we have heard one word, then it will keep it in store. So next time when we'll hear that word, it won't be that new, right? We'll be very comfortable. So today I'm preparing you for that, because from tomorrow onwards, all the topics which will be coming, there'll be lots and lots of soft tissues. So when we'll be describing those soft tissues, we'll be describing them with reference to medial pterygoid plate, lateral pterygoid plate, all these concha, then hard palate, right? Zygomatic arches. So that way we'll be describing it. So it will become much easier. In fact, we'll be revising all the foramens, right? And you should be absolutely fine with those foramen. No mistake. Right? So we'll do that also. Okay. So this is fine. Now let's see from the side. Posterior nares, right? See, it looks like a Siddha Sada skull and the spinal cord, but think it this way, that those posterior nares, right? Posterior nares, what were they? Posterior nares were the posterior most part of the nasal cavity. That means this was the nasal cavity. Okay, so nasal cavity. It will open in what? It will open in nasopharynx, right? So this would open in nasopharynx. Okay. Nasopharynx itself is a wonderful topic. But where would be that nasopharynx? Well, where the posterior nares open. So where do these posterior nares open? Well, we just saw that, right? We just saw that those posterior nares, they will be opening. They are in between medial pterygoid plate, right? They are in between medial pterygoid plate. So this should be the location of nasopharynx, right? That would be the location of nasopharynx. So where is nasopharynx? Well, nasopharynx is, we need to give some landmarks. Above it is all-time favorite, our basiocciput. It is our basiocciput. Why it is basiocciput? Why it should be basiocciput, right? We don't believe. But well, there is a reason. Basic occiput is that part of occipital bone which is in front of, which is anterior to foramen magnum. Through foramen magnum, what is going through foramen magnum? Well, the spine would be going, right? So that means here it has to be basic occiput. True? So now it is, we are convinced. So we say this is basic occiput. Okay, this is done. Anterior side, so it is so easy. Medial pterygoid plates, right? Medial pterygoid plates. So that's how they are forming. So medial pterygoid plates, on top it is basic occiput, and then the spine is going. Spine is starting at C1, right? It is C1. So this is C1. And in C1, there is no body. So what was there, right? We talked about it that in C1, that would be the anterior arch, right? Anterior arch of C1. So excellent. You have created all the boundaries, right? And without any confusion that where exactly the nasopharynx is, anteriorly it is like medial pterygoid plate. On top it is basic occiput, and posteriorly it is the anterior arch of C1. Done. And then the nasopharynx would be going down. So there is nothing like inferior or lower boundary, right? Things will be going down and there'll be lots and lots of structures. But well, all those structures, they don't hang in the air, right? They need some support. But so these bones, they will be giving the support. That's it. So in any city, when you go, if you know all the roads, all the landmarks, then it becomes much easier to figure out that where to figure out any of the house. Same thing is over here, right? That's the purpose of our today's session, to make you so comfortable with all these names, their locations, so that then it would be like absolutely a piece of cake to relish every topic which will be starting from tomorrow, because it will be then only soft tissues. Now see this. What we are talking about inside the skull. You must have noticed that right from the beginning, we are flip-flopping between outside and inside, right? Inside the skull, outside the skull. As such, one method is like start studying all the external structures and then enter into the skull, and then start discussing it. Truly speaking, it makes subject very difficult. Here, today you have to visualize it in such a way that what is happening to this particular bone when we are watching from inside, when we are watching from outside, because it is same plate, right? It is the same bony plate which will be forming multiple walls. Say for example, this is inside skull, right? So here it is inside the skull. Now this inside the skull, looks wise, it is telling that yes, it is divided into three parts, right? Anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. Who is dividing it, right? One. Just by looks at it, this line, right? This line, it is dividing it. Which bone could it be? There can be only one bone, and that is the sphenoid bone. So we'll call this as the sphenoid ridge. Sphenoid ridge. Okay. Then there is one more. It is this portion, right? And looks wise, looks itself was telling that this is the petrous part, right? That royal petrous part, right? So sturdy. So that is the petrous part of temporal bone. So that's petrous temporal. So we'll say petrous temporal. So they are dividing, these are the landmarks. They are dividing the entire skull into, that is the inside of the skull, into anterior, middle, and posterior cranial fossa, right? Posterior cranial fossa. This is singular, and fossae is plural. So that's how it is divided. Now see, there are so many foramen, etc. Right? We are coming to that. Now see, this is for the orientation. The bone which is over here, this one, right? This is inside the skull. So that means it is absolutely anterior. So we are talking about anterior cranial fossa, right? We are talking about anterior cranial fossa. This anterior cranial fossa, so this is the floor, correct? This is the floor of anterior cranial fossa, right? Anterior cranial fossa. So that's the floor of anterior cranial fossa because we have sliced the skull. But when we see from the anterior, right, this is front, the second one, this is outside and this is front. This view is from top. From top we are watching. So we are watching this portion, correct? We are watching that, this one. So that is what it is, roof of orbit, right? It is roof of orbit. And which bone it is? Well, whether it is this or that, the bone is frontal bone. So frontal bone is as such so big. This frontal bone is forming the floor of the anterior cranial fossa and it is forming the roof of the orbit. Well, the roof of the orbit, and then if you cut, so then obviously that is the anterior cranial fossa, right? So this is clear? Okay. This portion, right? A sharp ridge in between, and then there are perforations, right? Those small dots. This is what is called as the Crista Galli. Crista Galli, right? This Galli actually it means a narrow passage. To be simple, you can say it in Hindi, it is like gully, right? It is like gully, a narrow passage. It's a narrow passage, right? So that is Crista Galli. What it is doing, we'll see. But see, there are dots, right? All those dotted things. Okay. Here it is. Much better view, right? Much better view. So that is Crista Galli, right? A prominence. On both the sides, right? This is like a perforated bone, right? Perforated bony plate, perforation. There are so many holes in it, right? So it is looking like a perforated bony plate. But if we say perforated bony plate, it is not that impressive, right? We give some impressive name. We give cribriform plate. Cribriform plate. Right? Now it looks very impressive. It's cribriform means it is sieve-like, right? What is sieve? Sieve is the chalni, right? That when we make tea, right? Here is our cup, right? And then we put the chai from top. So it is this chalni, right? That is dotted. So that's it. That is cribriform plate. Cribri means something which has got hole. That means it is like a sieve. Sieve means chalni, right? So this is the cribriform plate. And this is from where the first cranial nerve, olfactory, cranial 1, those fibers will be passing, right? So that's for this. Okay. This cribriform plate, right? those holes. It should open where? See, here it is. Watch this. That's the only thing which I wanted to show. That this is anterior cranial fossa, right? And over here, via the nasal cavity, we are watching the roof. So that is fine now, right? This was forming the roof of orbit. So obviously this is in center. It is in center, so it would be opening over here, right? So these are that is where the filaments of olfactory, that is cranial nerve 1, they will be passing, right? This is sensory, right? So that sense of smell, it is over here, right? Good, right? So this is like, if we want to write very specifically, this area is what? Well, now you know that it is roof of nasal cavity. Okay, moving next. Now see, the anterior is this, right? This is anterior cranial fossa. Now this in between, this entire bone, right? That is the sphenoid, and that is sphenoid. But this portion, this, that is also sphenoid, right? This is a flat structure, and in fact, it is the location for sphenoid sinus. It is for sphenoid sinus, right? This is how, and how are we really figuring it out? Where exactly it is? Very simple. A flat area behind. Now this cribriform plate, so it is our friend, right? We know it very well. So we simply say it is the flat area behind cribriform plate. Make sense? Right? So that would be sphenoid sinus. So when we'll be discussing the paranasal sinuses, we'll be talking about, okay, there is maxillary sinus, there is sphenoid sinus. So the moment it is said sphenoid sinus, that means we are talking about this flat area, the flat area which is behind cribriform plate. So even if you close your eyes, you find that, okay, nasal cavity, roof of the nasal cavity, that which is opening into that cribriform plate, right? In between there is Crista Galli, and just behind there is sphenoid sinus. Orientation, okay, very simple. This is anterior, this is posterior, right? This is anterior, posterior, and we are watching inside the skull, right? Inside the skull. Skull cap has been removed. How can we say that? Simply because of our very fine friend Crista Galli, right? Crista Galli. This Crista Galli is inside the skull. So that means this is anterior cranial fossa. If it is anterior cranial fossa, now things are easy, right? And as you'll be familiar with more and more those structures, it will become much easier. Oh, here it is. See our big friend. This is petrous temporal, right? Such a big one, right? Petrous temporal. And this one, right? This half, that is none other than Foramen Magnum, right? I hope now you are oriented properly. Okay, all good. Okay, so what I was telling, yeah. So over here, remember this sphenoid sinus, right? All these words, they are going to come very soon. All right, next one. See this. This is so important. So important. Some of the structures, else they look so complicated, but in reality they are much easier. We are now dealing with sphenoid bone, right? Sphenoid bone. If we are dealing with sphenoid bone, so then that means we are talking about this middle cranial fossa, right? This one is middle cranial fossa. Okay. If that is middle cranial fossa, one very prominent thing which is seen is that there is a big gap, right? There is something like such a big gap. This one, this, I'll change the color. I'm talking about this part, such a big gap, right? So it has to be something interesting. Okay. But meantime, this middle cranial fossa, it is like this, right? It's curved. So there is floor, there is anterior wall, and then posteriorly, so there is petrous temporal, right? Here is the big boss, right? That petrous temporal is there. But this sphenoid, right? It is forming the anterior wall, curved anterior wall. That wall is here, right? So can we call this thing as anterior wall of middle cranial fossa? Okay, chalo मान लिया. But then where exactly it is? Well, here it is. How do we know that it is like anterior structure, a wall-like structure? We are now watching the skull from the front part. This is the front view. This is the front view. When we are watching from the front, right, these are the orbit. And straight away, as we go inside, we hit this posterior wall, right? This one. This one is the posterior wall of orbit. So think it this way. The orbit is there. Who was forming the roof of the orbit? Anterior cranial fossa, right? Which bone was that? Well, that was frontal bone, right? So here was the frontal top roof. That was frontal, right? This was frontal on the top, on the roof. And then there is middle cranial fossa. In between there is wall. So if the eyeball is here, right? Eyeball is here. So this wall, which is the anterior wall of middle cranial fossa, will be forming the posterior wall of orbit, right? To make it still better, here anterior, middle, posterior, anterior, middle, posterior, right? Cranial fossa. Eyeball is here. At least let me draw it circular. Eyeball is here, right? So, and eyeball is not into the skull, it is underneath. So let's draw it like dot 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 dot, right? It is underneath. So when there is a wall between anterior and middle cranial fossa, that would actually be forming the posterior wall of orbit. Good one, right? So that's the reason two images they were kept together. Yes, it will come. Not at a very high level, right? It is not that complicated. Things would be better and better. Okay, see, here I tried to make it a bit easy. Just to reduce some imagination. Okay, say this is a zoomed portion of, say, middle cranial fossa. And in middle cranial fossa, right, I'm taking it a bit back. This is the region. This is the region, central portion. That is which is in focus. Okay. So here it is. Here it is this, and it is going like this, and it is going like this. So this one is anterior right? Why anterior? Here it is. Here it is, our that cribriform plate and Crista Galli, CG, Crista Galli, right? Cribriform plate, right? So that is anterior. Good. And this one is posterior. So obviously, if that is anterior, it has to be posterior. And over here, so these are the structures which are lying, right? This is nothing but pituitary fossa, right? It is nothing but pituitary fossa. That master gland that will be residing over here. This is the address of pituitary fossa. So these are the process, right? These are the process extensions. So they are called as the anterior clinoid process. Anterior, so there has to be posterior, otherwise we could have called it clinoid only. So these are the posterior clinoid process. Okay. Posterior clinoid process. These are the anterior clinoid process. But then what this horse is doing over here? Well, this entire complex, right? This entire thing, this whole thing, it is given a very nice name, right? Very impressive name, Sella turcica. So that no non-medico understands that what exactly it means. Actually, it means Turkish saddle. Imagine their imaginations. Wow, imagine their imaginations. That by looking at these bones, they were thinking about that equestrian, that horse, that it is like Turkish saddle. They look like this. Well, actually, it is quite true. See this Turkish saddle. This is like anterior clinoid process. This is where the pituitary sits, and this is the posterior clinoid process. Right? That's the speciality of this Turkish saddle. There is prominence above, means in front and behind, and in between there is seat. That's the thing over here. That's the pituitary fossa anteriorly and posteriorly. This is a depression, right? There is a gap. So in that space, pituitary gland lies, right? Okay, so that was our Turkish saddle. Now things are not stopping at this point. When we have used this word Turkish saddle, so then we have to add something more, right? I'm just creating a space over here and I'm writing the posterior clinoid over here, right? Posterior clinoid process, correct? Why we created this space? Because over here there is a slope. There is a slope, right? And that slope, we need to give some name to that slope. Well, this is just behind the saddle, right? This is just behind the saddle. Our Turkish saddle, that was over here. This was Turkish saddle. This area is behind. So, well, again, our imagination has started coming up. We call this dorsum sella. Sella is saddle, right? So it is dorsum sella. And then it goes all the way to our all-time favorite basi occiput. And then from basi occiput, this would be foramen magnum, right? Now, if you are into the skull, you should be able to say so comfortably that all the way we started our journey from Crista Galli and those cribriform plates, cranial nerve 1, moving on to anterior clinoid process, and then then talked with pituitary fossa, right? Had a coffee over there, and then from this posterior clinoid process, we had a nice slide, and that was the dorsum sella. We reached to the base occiput and then foramen magnum out, right? This is how the entire midline structure is arranged, all the way from Crista Galli to foramen magnum. Then in case if you jump foramen magnum and then you take a turn, that was where that cruciform eminence was there, right? Cruciform eminence for those venous system. That is the transverse venous system, and then they were landing into the sigmoid ones, right? We talked about it. And in case if you have any confusion, all those things, they are going to come back when we'll be talking about blood supply, right? But this part should be clean. All right. Everything known to you, so I'll not write. This is frontal, this is parietal, this is temporal, this is zygomatic, this is maxillary, this is sphenoid, right? This one is ethmoid. That ethmoid is actually a super chupa Rustam. Only small portion of bone is seen into the full skull. If you really want to see the complete ethmoid bone, and we'll see that later, right? We have to dismantle the entire skull, and then the ethmoid comes out, and then we find that ethmoid is so complex, but it is completely hidden. The best part is that we'll be learning ethmoid when we'll be talking about nasal cavity, right? Because that's where we'll find that this is such a beauty, right? So nice. Then this is the lacrimal, and this one is nasal, right? But that's it. These are the bones. But there is no fun if things are that simple. You know? This roof, right? This frontal bone is okay, right? And yeah, in one of the section, right, there was, and when we sliced that bone, right, we saw that there were few spaces, few holes. They are nothing but frontal sinus, right? Those are frontal sinus. Okay. So this is the frontal bone. This frontal bone which is forming, let's remove this, right? So that there is no confusion. This frontal bone is pretty widespread. Huh? See? From the root of nose all the way it is forming roof of orbit. A roof of orbit. Well, roof of orbit, that's why this particular plate will be forming what? Into the anterior cranial fossa, floor of the anterocranial fossa, right? And it goes like this, right? And then it is forming. So it will be coming in contact with the temporal fossa also, right? So far, so good. Here it is. Now very easy, right? So most of the anterior cranial fossa, right, that is formed by this frontal bone. It's by frontal bone. It's by frontal. And say this is what I was talking about, right? All those, they are frontal sinus. Frontal sinus. Right? One of the all those paranasal sinuses. We'll talk about it. As I said, it's a separate topic. And see the cribriform plate, this one seen very nicely, and here it is, right? See, this is where, this is that sphenoid ridge, and that sphenoid ridge, it is leading to that middle cranial fossa, and this entire bone, right, this full bone, this bone, that is the sphenoid bone. And if that is the sphenoid bone, this is the flat area, right? This is the flat area which is just behind the cribriform plate. And who is it, right? What is the importance? Who is it, right? Who is it? The flat area just behind the cribriform plate, right? It is part of the sphenoid. So what should I write over here? Right? Whatever you will write, I'll write it over here. I'll wait till you give answer. So which structure is just behind cribriform plate? In time, this is middle cranial fossa. अरे नहीं, hypophyseal fossa तो we have not even talked about. We have not talked about. In fact, hypophyseal fossa, right? So this is, we are talking about anterior cranial. That's right. That's right. See, sphenoid sinus, right? You remember sphenoid sinus. This is that hollow, right? The sphenoid sinus. That's right. Then this is like anterior clinoid process, this one, right? And that's our pituitary gland, where it will be sitting. That's the fossa, right? Otherwise, this is not fossa. This is a flat structure all the way, right? And that's how it is formed. Okay, good, good, good. Over here, if I say that the lateral orbital wall, right? Lateral orbital wall, that is by zygomatic, correct? Zygomatic bone. Very good. Here it is, right? Here it is. So lateral wall is by zygomatic. Done. So that's the zygomatic arch. The joint venture, right? And this one is the floor of the orbit, right? This is floor of orbit. And floor of orbit is by maxilla. And maxilla is what? Maxilla is upper jaw bone, right? So best part is, that is when even if you close your eyes, you see that where is that roof? Well, roof is by frontal, right? By whom the posterior wall? Well, posterior wall is by sphenoid. What about the lateral wall? Lateral wall is by zygomatic, right? And what about the floor of orbit? Well, floor of orbit is by maxilla, right? It leaves only this small strip, small portion. Well, that is the chupa bone, ethmoid, right? Very shy bone, right? All right. Now, this portion, this maxilla, right? You must have noticed that whenever there is common cold, the thing what we call as the sinusitis, right? This area, it pains a lot, right? It pains a lot, this one, right? This is the largest sinus, largest of the paranasal sinus, and that is maxillary sinus. Now these sinuses, they are actually very important, because if these are rock solid heavy bones, right, like femur and the say tibia, fibula, right, strong bones, so then weight of the skull would have been so high. So these bones, they are deliberately made lighter, right, by putting those air spaces inside. Okay, that is one, to make the bones light. But second thing is, it gives resonance to the voice, because otherwise when you are having, say, that common cold, right, and you try to speak, your voice is so heavy, right? So heavy. And there is no resonance. Resonance is this when voice vibrates. That is resonance, right? So that is where, say, these sinuses, they come into picture. Okay, so this is the largest sinus, and that is maxillary sinus, right? Just the orient for the orientation. You can just use this thing as a practice. Now again, this is the base, right? We are watching the base of the skull. That is from underneath. So these are teeth, and this one is hard palate. Some of the phrase that hard palate is what hard palate is, roof of the mouth and the floor of the nasal cavity, right? Because over here you are watching it ulta, right? In real life, right? Think it as if it is in you. So that is the hard palate, right? Up. That is the hard palate. So these are the upper teeth, right? These are upper teeth. To see this thing better, right? We need to remove the zygomatic arch. Zygomatic arch. So many doubts would be clarified in next 1 minute. Zygomatic arch has been removed. When it is removed, it means we come across two bones. One bone, this is our sphenoid bone, very important bone, sphenoid. And this is the upper jaw bone, the maxilla. Maxilla or maxilla, bas, maxilla. So they both meet over there. But when they both meet, there are few gaps. There are very impressive gaps between sphenoid and maxilla. They both meet, yes, definitely, right? They meet over here, they meet over here. But then there are few gaps. The first gap is over here, this one, which is like a vertical gap. Then there is another gap which is like an horizontal gap. So this vertical gap, it is between whom? Well, why to, let's do this Namkaran Vidhi by ourselves. Okay, we say this is what maxilla, yeah, that is maxilla. So we'll call it maxillary, right? Which bone is this? Well, this is sphenoid. But in that case, this is also sphenoid. This is also sphenoid. No. So this thing won't be good. Let's be more specific. What are these plates? Well, they are pterygoid plates, right? See the pterygoid plates. That's what we were doing. That those pterygoid plate, medial and lateral pterygoid plates. So there are pterygoid plates. Okay, they are pterygoid plates. So now this is between maxillary and the pterygoid plates. So it's a fissure, right? It's a gap. Very gracefully, we name it as pterygo maxillary fissure, right? So simple. Pterygo maxillary fissure. Okay. We don't have to use that much brain to answer this thing. Because over here, this is a gap which is horizontal, right? This is horizontal. So before giving any name, we would like to see it from other angle. Right? So let's see it from other angle. And that other angle is like, here it is. Here it is. When we are watching it from the orbit, right? When we are watching it from the orbit, this is what it is getting shown, right? This is what is seen. We are talking about this. So here, if you really see the bones which are getting formed, this one is sphenoid, this one is maxilla, because maxilla was forming the floor, sphenoid was forming the posterior wall, and that's the gap between both of them. That's the fissure. Okay, so we would like to call it, because it is very important, we'll call it orbital fissure. Orbital fissure, right? So sphenoid भी नहीं, maxillary भी नहीं, just orbital fissure. But then it would say, okay, yes, there is one more orbital fissure which is above, right? We'll see that. All right, no problem. We'll call it inferior orbital fissure. So that is inferior orbital fissure, right? So what we see over here, when we actually removed the zygomatic process and this horizontal one, this is inferior orbital fissure, right? Okay. Now you should be comfortable in this, because it is exactly the same thing which is shown, right? Just the angle has been changed slightly so that you can watch these pterygoid plates. These are the pterygoid plates. It means it is this portion which is pterygomaxillary fissure, right? And it is this one which is inferior orbital fissure, right? So this is inferior orbital. Inferior orbital name is given simply because there is someone called superior orbital fissure. That's it. This name is surely more scientific. So it is pterygomaxillary fissure. It means now whenever we'll be talking about that, these are the structures which will be passing through pterygomaxillary fissure, immediately we'll be knowing that they will be like from this area. And yes, it would be covered by zygomatic arch. And then there would be temporal fossa. And in that temporal fossa, there would be temporalis muscle, right? So that means the structures which will be coming out from pterygopalatine fissure, they will be coming in contact with the temporalis muscle, because that is temporal fossa, right? Okay. So yeah, we saw this, right? And this inferior orbital fissure, this is also opposite side, inferior orbital fissure. Now see in this, as we said, that sphenoid, that central portion, right? That central portion which was having everything with him, right? That sella turcica and those anterior clinoid, posterior clinoid, everything. And then there was greater wing, there was lesser wing, and hanging were the pterygoid plates. Okay. If this is the scenario, right, at the base of the skull, it becomes much easier that this is what sphenoid bone is. That's the sphenoid bone, and these are nothing but those pterygoid plates, and these are like posterior nares, choana, right? And in between that bone, that is the turbinate bone. Fine, that's the foramen magnum. This is base occiput, right? And all good, right? This is foramen magnum, and that's and then there will be all nuchal lines, etc., etc. This is the zygomatic process, right? And this is the fossa, that is the temporal fossa. So that is anterior clinoid process, right? We justified cranial nerve number 1, that is olfactory. This one, right? It will go via that. Now just got a call from cranial nerve number 2. That is optic. That now it is my turn, right? Optic nerve. So that optic nerve is going via this space, say this one, this one. So through this point, it will be entering into the orbit. It will be entering into the orbit, right? So that is called as the optical canal, right? This is optical canal, right? So here, this optical canal, so if you see this is the ridge, right? That's the sphenoid ridge. Sphenoid ridge. Now it is seen more clearly, right? We have just zoomed it, and that's from where the optical canal will be going. But see, we said this is anterior clinoid process. So anterior clinoid process, right? There would be posterior clinoid process, right? Then this is that slope that is called as the dorsum sella. And then there was basi-occiput, right? All good. Right? Now we are talking about one important thing, the junction between greater wing and the lesser wing. Greater wing of sphenoid and the lesser wing of sphenoid. They both meet. But see, when these bones meet, the trouble with these bones is all these bones are very irregular, right? Even this greater wing and lesser wing, they are bada bhai, chota bhai, still there is some gap between them, right? There is a gap between them. So, see this. That gap is nothing but greater wing, superior orbital fissure. Right? Now, before that, we would like to say hello to this space. What is that? That was optical canal. That's where cranial nerve number 2, optic nerve, that would be passing. Optic nerve, ophthalmic artery, right? They will be passing over there. Okay. What about this? Right? This is the greater wing. And this one is lesser wing. And that's the gap between both lesser wing and greater wing. And that gap is nothing but superior orbital fissure. That is superior orbital fissure. So what we are watching over here, this is superior orbital fissure. And the optical canal. These are the two structures. So it means this was inferior orbital fissure. And that inferior orbital fissure was between sphenoid and the maxillary. Right? So because they said that, chalo, let's not fight, and inferior orbital fissure was the name given to that. This is superior orbital fissure. Right? Very clear. So when such big gaps are there, obviously very respectable structures will be passing through it, right? So let's see them. Here it is. See, right? This is inferior orbital fissure between sphenoid and maxilla, and this is superior orbital fissure. Superior orbital fissure is between bada bhai and chota bhai, greater wing and lesser wing, and here it is the impressive optical canal, right? Right. That's the thing. This is when we see at an angle, right? So this is the greater wing, this is the lesser wing, and that one is superior orbital fissure. Superior orbital fissure, right? And yes, that's the optical canal. So now we are quite familiar with middle cranial fossa. We know this anterior clinoid, posterior clinoid, that sella turcica, that entire area is known. Even this sphenoid sinus is known, dorsum sella is known, base occiput is known, greater wings, lesser wing. And then when we go out of the skull, so then there is medial and lateral pterygoid plate, and then there was nasopharynx, right? As we go out, there was temporal fossa. And we find that temporal is muscle over there, and bounded, protected by that zygomatic arch, which is like a joint operation between zygomatic and the temporal, and zygomatic is a cheekbone, right? So it goes out. So it is making the whole picture good. Yes, yes. Things are things are pretty similar, almost of the same shape in every skull, right? Almost. So then say when we talk about various skulls, that is those skulls of Cro-Magnon and Neanderthal, those skulls. So there we find that their skulls, they were of some different shapes, right? Maybe greater wing was not that great and lesser wing was not that less. All those variations might be there. But when we talk about us, yes, more or less they are very similar, very similar. Yes, regarding those foramens, there might be some variation, but that variation is not much. It is just some change in the diameter, bigger or smaller, because it is the formation of the bone, right? But structure wise, yes, very much, very much. Otherwise, so man, you'll go crazy, right? So it's like then you have to figure out that okay, Harsh has got say superior orbital fissure, which is on the this side and it is of this long, and in me superior orbital fissure is smaller and inferior is bigger. Arre baap, right? We'll go crazy. Yeah. Adding one more word, right? Step by step, we are adding, and now this is easy. This one and this one. Why it is very easy. These are what? Immediately we see that, okay, we are talking about the base of the skull, right? Let's orient ourselves. Base of the skull. Why base? Well, these are upper teeth. These are upper teeth, right? So we are watching the skull from below. If we are watching the skull from below, well, this is the middle one. So these are pterygoid plates. So this is the lateral pterygoid and this is the medial pterygoid. And when they are medial pterygoid plates, so then why not utilize this space, right? This is like a fossa. There is one plate, there is second plate, so this means there would be some space in between. Well, that is called as the pterygoid fossa. That's the new name, right? Pterygoid fossa. Important? Yes, very much, because nothing is useless in the body, right? So this would be again one interesting topic. Done. What would be the location? Well, this would be just behind maxilla, है ना? Right? Behind maxilla, because maxilla to is anterior, right? So this is just behind maxilla. That's what we see it over here. Okay. Who is this? Who is this? Right. So stylish. And who is this? Well, we said that, right? This is muscular mastoid. And this one is the stylish styloid process, right? Mastoid process, styloid process. And that one is external auditory meatus, right? Well, they are coming within few minutes. Okay. Meantime, this one, right? This one, these are all styloid, pterygoid process, correct? These are the pterygoid process. These are medial pterygoid process, and these hook-like structure, they are called as the pterygoid hamulus, right? Hamulus, hamulus. And they are on the medial pterygoid plate. So these are on medial pterygoid plate. So medial pterygoid plate, they are having that hook-like structure like this. So this is for what? Yes, it is actually like a hook, right? Like a sling for one very specific tendon. So this is tensor veli. And it is fine if you forget this name because it will come when we'll be discussing the pharynx, right? It is called as the Palatine. Right? Some football player's name it looks like, right? So it is tendon of this muscle which glides over there, right? That's what we'll see that. So that is the importance of this hamulus. Yes, styloid process. That's right. Okay. Now this one, this bone, as we said, this is the ethmoid bone, right? Will not be touching this bone now. Because this entire complex, right, it has to be discussed when we'll be discussing it with the nasal cavity, right? So Crista Galli, cribriform plate, right? Crista Galli, cribriform plate, bus. That's it. We'll just keep it at this point only because this bone is almost hidden in a living skull, almost hidden, right? We need to really explore in the exploratory way to see it in full content. So that's it. This is, right, ethmoid, right? That's the ethmoid. So this is the only area where it will be showing its presence, right? Over here, a small strip which is forming the medial boundary, right? It is forming the medial wall. In fact, partly medial wall of orbit, and then cribriform plate into the nasopharynx, right? Michael Platini, yeah. So that one is ethmoid. Then this one is lacrimal, and this one is nasal, right? So actually that nose, right? That nose which is like this, right? This is cartilage. This is cartilage, right? So rest of them, the nose is formed by cartilage. Otherwise, nasal bone is only this much. Now see, between, right? This is the gap. Now we are watching the skull from the top, right? Not from absolute top at an angle, because this is the opening of nasolacrimal duct opening. So it is via this portion, right? Tears which are from eyes, they will actually go into the nasal cavity, right? So tears from corner of eye, they will be going into the nasal cavity. So that is via nasolacrimal duct, and that is where it passes, right? So over here, it is just over here, right? So we have to just tilt it and we have to watch from the top. Okay. Now you should be oriented quite comfortably, right? This is base skull, right? And what we are watching, this is hard palate, right? That's the hard palate. And hard palate is by maxilla, right? So M, maxilla. But well, palate is not only formed by this maxilla. There is another bone, right? And that bone is this. That it is called as the football player, right? Palatine bone. So that means that gentleman who was using that hamulus, right, must be related to this bone. Yes. So that palatine bone, this is the lower part of palatine bone is forming this posterior part of hard palate, right? Makes sense? Because this is the hard palate, this is anterior. So this is also forming the hard palate because it is a bone. So this is the posterior part of hard palate. Correct? This is the posterior part of hard palate. Still, if we just tilt the skull and we come to know something more, here it is. Here it is. This white one, right? White colored, that is palatine bone. So it is not forming only the posterior part of palate, hard palate, but it is also forming side walls. So these are the side walls of nasal cavity, right? Nasal cavity, because these are the posterior nares. So it is forming the side walls also. So side walls of nasal cavity, posterior part of hard palate, and he is palatine bone, right? Palatine bone, football player. Now starts the real fun. Here it is. This one, right? That is what? Optic canal, right? It is optic canal. Simple. So optic canal, it will be going further and it will be carrying what? It will be carrying, say, optic nerve, right? Optic nerve, cranial nerve number 2. Then ophthalmic artery. So these are the two important structures which it will be carrying. Apart from them, there are some meningeal sheaths and sympathetic nerve fibers, etc. But don't worry, that is when we'll be discussing orbit itself, right? Otherwise, these are the two main structures: optic nerve, ophthalmic artery, and then few sympathetic fibers. Right? So this is done. So nerve number 1 down, nerve number 2 down. Now it is the turn of 3, 4, 5, 6, 7, right? So next here. Now you remember we were talking about this, 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 this one, right? Superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. In order to remember nerve supply of these, it is so simple, superbly simple. Remember SO4, right? And LR6. Whatever the way, right, you want to remember, SO4 and LR6 rest all by 3. It means superior oblique, that is by cranial nerve number 4, lateral rectus is by cranial nerve number 6, and rest superior rectus, inferior rectus, medial rectus, inferior oblique, all by number 3, plus levator palpebrae superioris. Unnecessary complicated name. Levator means elevate. Palpebra means this eyelid. And superior ridge means upper eyelid. The muscle which will be opening the eyes, right? Right, the way it is shown in movies, right? And when the eyes are opened, so that is by this nerve number 3, correct? So 4 is, so over here it is the 3 first, right? 3 is oculomotor. In fact, all these 3 nerves, they are motor, right? Because they won't be carrying any sensation. They will be just, brain will be telling that, okay, move the right, left, right, up, down, roll, right? All those things. So that's how it would be done. So olfactory, optic, oculomotor. This 4th is trochlear, right? 5 is trigeminal, it is not coming over here. And this is 6th, it is abducens. So 3, 4, 6 done, right? Why we are telling all of them over here? Because that's how I felt, that levator palpebrae superioris, right? How fancy it looks like, right? But as such, its function is was doom when the eyes are opened. Means that I remembered it like this as sulfur oxide, and I remembered this as ladies representative, right? I'm sorry, but that's how I remembered, so that you never forget. Okay. So over here, there were 2 things. Superior orbital fissure, right? We did all this katha just for the superior orbital fissure. And that superior orbital fissure, but that superior orbital fissure is doing nothing, but it is carrying all these Mahanubhavs, right? It is carrying cranial nerve 3, it is carrying cranial number 4, it is carrying cranial nerve number 6, all these 3. ब्रेन का, वेल ब्रेन की नस फट गई है, दैट इज अ वेरी जनरल थिंग, राइट? यूजुअली नस मीन्स it is artery, it is artery, and all those intracranial hemorrhages, they are because of the involvement of any of those vessels, right? Yes, we'll be talking about those vessels when we'll be discussing the CT and MRI once we finish it, right? There is so much of radiology involved into this, and you'll love it. So at that point we'll discuss this nas fat jana is what, right? Nothing but it is like there is a narrow space. There is very less space, and whenever there is accumulation of blood, whenever there is any of the extra thing into the brain, into the skull, right, it leads to those compression effects. So that is where it starts generating so many complications. Okay, so superior orbital fissure 3, 4, 6 neat, but then where is this 5, right? 5 trigeminal. Now the name itself is like that Tridev, right? Trigeminal. Now it is this trigeminal nerve, right from the beginning, right? It will start harassing. First thing first, trigeminal would say that I have got multiple divisions, right? One of the division is ophthalmic. Then there would be maxillary. Then there would be mandibular, right? Mandibular. So that's how it will say that ophthalmic, maxillary, mandibular. How to remember it, right? 3 fingers and put it over here in style, right? So this is going towards eyes, ophthalmic. This is going towards maxilla, so maxillary, and this is going towards mandible, so mandibular. So trigeminal has got ophthalmic, maxillary, and the mandibular. right? So this superior orbital fissure, if you really want to add something, what would you add? I know that you know it so well, right? It has to be the ophthalmic, because, right, this is not the area of maxilla or mandible, right? So it would be ophthalmic division of cranial nerve number 5, and that is trigeminal, right? So trigeminal 1, right? First part is down. So we know now cranial nerve number 1 down, 2 down, 3 down, 4 done, 5, 1, 2, 3, one portion is down, 6 done, right? 6 cranial nerves. So we have finished. Trigeminal, yes, hang on for it, right? So, but first portion is done, ophthalmic, that is done, right? So these are the structures which will be passing through this superior orbital fissure. Not that complex, right? Because it is something which is between greater wing of sphenoid and the lesser wing of sphenoid. Now you can talk so much about superior orbital fissure, you know, that what structures it is carrying, and how, where exactly it is placed. Okay, adding something to that now. See, just for the orientation, right? This one, that is optic canal. This one is superior orbital fissure. So if this is optic canal, right, it is anterior. Optic nerve, ophthalmic artery, it will be carried. So this is one. This is one, right? I avoided drawing circle because otherwise it will create a wrong impression that this is some other foramen. So this is optic canal, right? Second one, this one, this is superior orbital fissure, right? So this is second. Now just behind the superior orbital fissure, this is one more foramen, and this is called as the foramen rotundum. When first time I heard this name, I figured out that what's the meaning of this rotundum. And to biggest of my surprise, foramen rotundum was round. I cursed that person. I said, Baba, you should have said be round foramen, right? Why this foramen rotundum, right? But anyway, it is that. Foramen rotundum. Now, foramen rotundum, it will be carrying what? Immediately, right? That cranial nerve number 5 will come, and cranial nerve number 5 would say that it is the maxillary part, right? Because mandible to is quite later, after that it will come. So it will say go for this maxillary branch or the maxillary division of cranial nerve number 5, trigeminal, right? So that is carried. This is foramen rotundum. So done that part, right? Easy. Just the superior orbital and the optic canal at a very good angle, right? This is the optic canal, and this is the superior orbital fissure. This one is superior orbital fissure and optic canal. Just a good angle. Okay. Now that foramen rotundum, right? That foramen rotundum, what it was carrying the maxillary division of trigeminal, right? That maxillary division of trigeminal Now I'll just say one word, right? And you will say, yes, you got it. That foramen rotundum would open in, ready? Pterygo maxillary fissure, right? How sweet. You know so well, pterygomaxillary fissure. Pterygomaxillary fissure, right? On one side it was the sphenoid bone, on other side it was the maxillary. This is the sphenoid, this is maxillary, but this sphenoid would say, no, no, we are special, right? These are the pterygoid plates, so that's why pterygomaxillary fissure. That pterygomaxillary fissure, right? It is from inside, because all these nerves, they are emerging from the brain and then they are coming out. So via foramen rotundum, who was coming out? Coming out was maxillary division of trigeminal nerve, cranial nerve number 5. Yes, it makes sense because it is going to meet towards this maxilla, right? Very fine. So this is the important thing, that this foramen rotundum, right? Foramen rotundum, it will be opening into pterygomaxillary fissure, right? Good. Okay. If there was foramen rotundum, round, so then they said this is oval, right? So that's why it was called as foramen oval. But immediately they jumped on, no, no, such simple name cannot be there. So add come se come E, foramen oval, right? Foramen oval. So this is foramen oval. Now this foramen is carrying what? Is carrying nail, right? 4 structures. First structure, the moment I don't have to even say that. Whatever is left out of cranial 5, right? So it is only the mandibular division, right? So it is the mandibular division of cranial 5. Well, the important part is done. The second one, so right, so this is M. The second one is accessory now, right? That is the accessory mandibular branch. Now these are all accessory of maxillary artery, right? Maxillary artery. So that is this. This third one, this is important, lesser petrosal nerve. So that means there would be another nerve called greater petrosal. Yes, it is there, right? So this is lesser petrosal. Remember this. And fourth one, this is not very important because there are so many. This is just remember it like emissary vein, right? We'll talk about it when we'll be discussing the blood supply, etc. But well, this is foramen oval. That's important, right? This is the mandibular division of cranial nerve number 5. Well, that is foramen oval. So in that case, now one more, which is a small one, right? It is foramen spinosum. Foramen spinosum. And this foramen spinosum is bit sad because he has not been given any nerve, so he simply carries that one important artery. It is the middle meningeal artery. That's what it carries, right? Very important artery. So that's how they all are arranged. Moving further. Now see, orient yourself. Where exactly are we dealing with? So this is anterior posterior, so it is easy. Just write this is your foramen magnum and that is the anterior portion, right? This is easy. Then if that is the anterior portion, that means these are the pterygoid plates. When that is the pterygoid plate, right, we see that this one, this one is foramen ovale, right? Then back to back, this one is foramen spinosum. That's where it opens, right? This is the base of the skull. So from inside over here, right, this is the base of skull, right? And that's ovale, and that's spinosum, right? So ovale is, it will open just behind lateral pterygoid plate. So this is excellent, right? This one is lateral pterygoid plate. See, now we know the landmarks. Lateral pterygoid plate. So that lateral pterygoid plate, which is, yes, which is forming that, and this one medial, which is forming those boundaries of nasal. So this is ovale, foramen ovale is just behind and lateral to lateral pterygoid plate. You got this. This is pterygoid. Right? Okay. And spinosum, that is carrying middle meningeal. Right? See this. Now, very, very interesting part. This is inside skull. Right? This is inside skull. Everything till this point was quite okay. But then there comes a very ragged appearance, very irregularly appeared. So they call that this is lacerated, right? This is damaged. So this is foramen lacerum. Foramen lacerum. Foramen lacerum means one who is got lacerations, irregularities, cuts, tears, right? So foramen lacerum won't like this, right? He'll say, no, it is not like that. It is because you guys are watching this in dry skull, right? You are watching it in dry skull. In reality, in real life, I'm much more graceful, right? So what really happens, to in order to see this thing, deliberately we put some tissues over there, right? Some substances. But in reality, what are they? They are all those fibrous tissues, right? So where we have artificially put this, but actually it such tissue is there, but it is not bone, right? It is fibrous tissue, fibrous and cartilaginous tissues. So obviously when the skull is dried, right, so these tissues, they are removed, and that's why it looks like lacerated. Otherwise it forms superb. This is such a nice round aperture, right? And this is where, through which internal carotid artery emerges. That's where internal carotid, right? This is a clean cut carotid canal system. Clean cut, very clean. So that's where internal carotid artery, that is, right? So this is a very clean foramen. But this is what we see in living skull. In living skull, right? So that's how we say that it is the carotid canal, right? That carotid canal which opens into foramen lacerum, right? That's fine, right? That's fine, but it is with those tissues, so that's how it actually forms a nice carotid canal, right? Nice carotid canal. Now, where is it? Where is the location of this one? Just medial to styloid process, right? So that is the styloid process, that is foramen magnum, right? So that is the medial side, and this is the carotid canal, right? This carotid canal, which is medial to styloid process, right? The last structure which is coming up, and it is actually very important. Before starting talking about this structure, because now this is the last page, whenever you go in aircraft, right? Whenever you go in aircraft, is it air hostess's birthday so that she is giving you all those candies and sweets and everything, right? Every time, right? Why do they give it? Okay. So here it is. Here, this one, that opening. This is the opening of auditory tube, or its another name is Eustachian tube. Now this is a tube. This is a tube which is a junction between middle ear and the pharynx. External ear, middle ear, and internal ear. Right? It is the middle ear where there is malleus incus stapes, right? Those small bones. And this is the ET, Eustachian tube. And that's where the pharynx is there, right? The function is, the purpose is the pressure balance, right? So its function is pressure balance. Now, when this pressure is not properly balanced, especially when your aircraft goes at a higher level, right? So then you start getting what is called as the tinnitus, right? It is the pain in the ears and then that whistling sound. If this ET tube is blocked, right? That is what leads to severe pain in the ears. What's the solution? Right? Well, there can be so many solutions. One of the sweetest solution is that sip water or suck this candy. So during that process, those muscles are involved and they will be keeping this eustachian tube open, right? Or chewing gum, right? Chewing gum. And if nothing helps them, so then try to do that, right? Do yawning, right? When a royal, don't do it right now, right? When you do it, right, it will open. And still, if that fails, so then nose closed, mouth closed, and then try to blow, right? So that pressure, it will, and you will get a pop sensation, right? And immediately the pressure would be released. So that is what is called as the how to open that eustachian tube block, right? That is over here, auditory tube. That's how it goes over here. But say that tube is not only such a small thing. In real life, you will find over here, it is extended by this cartilaginous tube. So that bony portion, and then it is continued with the cartilaginous part, right? So it is the cartilage part. That's how it is connected, right? Okay, as promised, say, let's say 1, 2, 3, 4, 5. Olfactory. So olfactory will be passing through, right? Those olfactory foramina, that cribriform plate, right? Cribriform plate. So that is done. Then optic. Now these are all cranial nerves we are talking about. So optic will be passing through optic canal, right? That is easy. Optic canal. Then 3, 4. Okay. We write 6 over here and like this. Yeah, this is good. So 3 is oculomotor. Then 4 is trochlear. 4 will be supplying whom? SO4, SO4 superior oblique, right? Then this is LR6, right? So that is 6 is what? Abductions, okay, right? Fifth has got 3 divisions. So that is ophthalmic, maxillary, and mandibular, correct? Mandibular. So this oculomotor, trochlear, ophthalmic division, and abductions, all of them, they will be going via superior orbital fissure, correct? So that is done. We change the color to this maxillary, right? Maxillary will be going via that round rotundum. And if it is via, and then this mandibular, well, mandibular is by that oval, right? So 1, 2, 3, 4, 5, 6 down. Moving on to rest of them. So 7, 8, 9, 10, 11, 12, right? Now to they are so easy. 7 is what? That facial. Facial, and this 8 is that vestibulocochlear. And both of them, we saw that internal acoustic meatus, right? So that is done. Internal acoustic meatus. Okay. Then comes this ninth. Ninth is glossopharyngeal. So glossopharyngeal and vagus, right? 9 and 10. So that is glossopharyngeal and vagus. And we know that they both pass through that jugular foramen, right? Along with the internal jugular vein. So this is jugular foramen with internal jugular vein, right? Now this 11 is spinal accessory, right? This spinal accessory has got 2 parts. Again, it has got one is the descending part and another one is the ascending part. Right? We'll be discussing these nerves individually, but this descending part, it would say, okay, I'll go with jugular. So it will go along with 9, 10 via jugular foramen. This ascending one, it will be going via foramen magnum, right? Royally. Foramen magnum. And last is what? Hypoglossal. And for hypoglossal, so there is such a good foramen, that is the hypoglossal canal, which was near that occipital condyles, right? So those hypoglossal canal. Now, if you remember this much, you'll be super confident when we'll be discussing these cranial nerves because you have known almost the whole path, right? So that's how things really go. And this skull is again happy, right? We talked about him so much, right? So thank you and see you tomorrow, right? I just save this thing, done, and I'll put it into our folder. All right, thank you so much. And in case if you got any doubt, just send a mail, right? Thank you and bye-bye.